So osteoarthritis, you've probably heard this word before. It's a degenerative joint disease where you have cartilage loss that eventually leads to pain. And at first you try to manage that pain, maybe with some over-the-counter medication, but eventually it starts getting more painful. And ultimately, really the only treatment is this joint replacement. So there's no treatments available that really are aiming to regenerate that damaged cartilage and bringing the joint back to a healthy state. When we think about cartilage and osteoarthritis, I like to think about it as kind of a road where you start having this kind of breakdown in your cartilage and you start having these cracks, but eventually those cracks become potholes and you need to fill those potholes to patch them up and fix them. So we were fortunate to be one of 5 teams in the US that was funded by the federal government to develop these new treatments to regenerate damaged cartilage back to a healthy state. So we're developing injection that goes directly into your joint, and in this injection, we have a particle delivery system. So these are small particles made of biomaterials, and the materials are engineered to release little bursts of a regenerative drug over a long period of time. And then the regenerative drug, we've shown in the lab that it kind of jump-starts those cartilage cells to be able to produce new cartilage tissue. But if you're later stage in osteoarthritis, those cracks can become these potholes. So I've been working with Stephanie Bryant, who's at the University of Colorado Boulder, for the past decade on these injectable biomaterial systems that are regenerative. But what's special about these biomaterials is that we're able to attach different proteins into them that create this regenerative environment. So we're able to put things that recruit cells from the body to come into the area and then tell those cells to become cartilage-forming cells. Sometimes the area we need to fill is larger than we would like. If you have these potholes and they're large enough, we would go put in this 3D printed structure that would provide mechanical support, but then we would also incorporate this hydrogel that has all these regenerative factors into it. And in the end, the goal is to return that joint to a healthy state and hopefully reverse osteoarthritis.